feet on the floor, or you're standing, I mean, obviously your feet are on the floor, or if you're sitting on the floor, then your pelvis, the tip of your tailbone, the sitting bones are on the floor, obviously. All we're going to do is we're going to rest your arms on your lap and allow the muscles either side of your spine to release, so that the spine itself can undo. So what stops your spine from undoing is the cable muscles either side tightening. Those of you with back problems, lumbar, even upper back, middle back, wherever, those muscles they need to undo. Basically, they need to undo in the place where it's hurting you. Where they've gone tight, they cause more compression. So we need to allow them to undo. So in effect, if you've got, there's your spine running up here, and you've got the cable muscle on this side, you've got the cable muscle on this side, and in fact, this needs to be able to allow itself to lengthen. So another unusual spine there. So as you're sitting, standing, whatever you're doing there, just release those muscles either side and allow the neck of the guitar to undo. Right, now we're going to start off with abdominal breathing because the other one generates heat. So abdominal breathing can a little bit, but it's not nearly as much as doing reverse breathing. So you're going to breathe in through your nose, down to your center. You're going to push on the diaphragm. Here's your diaphragm. You're going to compress the diaphragm downwards so it expands the abdomen, not just at the front, but also at the sides and the back. Right, so. And when you undo, when you breathe out, you just release the back first, feel the sides. Nothing may happen, but feel the sides, be aware of them, and then let the air come out the nose again. Let me just grab myself a piano stool for this, because it's astonishingly difficult to imagine you're in a different position to the one I'm in. It's an excessively large piano stool, but there we go. Okay. Right, so spine release, let go, back of neck, crown of head, feet on the ground, hands doing nothing, shoulders dropping, connecting to hips. Breathing down in through the nose, diaphragm compresses down, expands the abdomen, two pipes running round to the kidneys. Then release, exhale, back it comes and out. Right, now then. So that's the basic, right? That's the basic for this. So now the next thing about this is that you can consider your torso here to have three sections. Now this comes into some of the Qigong we've done in the past, where you've got the upper section here, you've got the middle section here, and you've got the lower, except our upper section is going to be a little bit smaller than in the Qigong. The upper section in the Qigong goes to here. So where your breastbone is, dig your fingers into the tip of your breastbone, right on the tip. So this would be considered your heart and lung area in some Qigongs. This will be considered, just go to your tummy button and a fraction below it, just a little bit low. That's your digestive section. And then the rest below that is eliminatory, getting rid of all the toxins in the body, getting rid of all the rubbish you don't want. For our purposes, for breathing purposes, find the tip of your tailbone, find the tip of your breastbone, and just go up to the middle of your breastbone. Not at the very top here, this is too high. Roughly speaking, in the middle here, there's an acupuncture point there. Well, there's acupuncture points everywhere, but there's a particular one which kind of is an important one, because this acupuncture point relates, in a sense, to your heart chakra. So it's right in the middle of the breastbone. And we now consider this to be the upper section. From here down to your tummy button, the middle section, and the remainder down below is your alimentary section. So we can divide the lungs almost into three, and I know there's no lungs down here. So what happens is when you breathe in through your nose, breathe down to the bottom of your lungs first so you feel your abdomen expand. Don't worry about going round, just feel the tummy expand. Good, and then just breathe out. Okay, so we're going to do the same again, but then you're going to do section 2 where you fill up to just in the breast, up to the breastbone, in the middle of it. Okay, so breathe in. Now, higher, fill up. So you feel some activity happening around here, right, possibly right around the rib cage. Yeah, okay, breathe out and get rid of that. Okay, we now do the third section as well, which is quite high up here. So you breathe into the bottom of the lungs, middle, upper, and then you breathe out. Now, what's crucial here is you don't let anything lift very much. Particularly, you don't let your shoulders go up like this. Yeah, the shoulders have to stay down. So you're actually only breathing up the last little bit here. You're not going to get much breath in, incidentally. So there are very few alveoli up at the top here, which draw the oxygen out of the air. Most of them are in the middle and they're definitely at the bottom. Yeah. So we again, breathe out, you get rid of it all. Okay, here we go. Breathing in, bottom, middle, upper, and release. Now, when you come to release, release in the same order, bottom, middle, upper, in that order. Don't start at the top, middle, bottom. So we go again, breathe out, clear out. Okay, ready? Breathing in, 1, 2, 3. And now here, 3, 2, 1. Again, 1, 2, 3, and 3 goes out, 2 goes out, 1 goes out. Now, if you find it makes you feel dizzy at all, it means you're actually breathing better than you breathed for a very long time. You're suddenly getting much more oxygen into your system than you normally do, and this is how you should practice breathing all the time. So the rest of your day is now going to be spent, breathing like this, because this is one of the best possible ways of breathing where you're really getting the best out of the air. So just we do it a few times. So 1, 2, 3, 3, 2, 1. Now just keep going, because you'll now maybe start to see that when you do the 3, 2, 1 on the out breath, the diaphragm is playing a really important role in this, because when you release here first, the diaphragm starts to give. It then pushes out section 2, the air, and then it pushes out section 1. So now the diaphragm is getting far more flexibility into it than it had before. Because you'll find that you're even trying to use your diaphragm to push out the air at the top as well. Now, the same is true for the in-breath. When you do it the other way around, you breathe in to the bottom, 1, 2, you're expanding here, but you're also trying to push down still. And 3, you're still trying to push down. And then you're released. 3, 2, diaphragm's lifted a bit more, 1, diaphragm's lifted a bit more. Just do it a couple more. Yeah, good. You'll find that if, just as an experiment, and it's worth doing the experiment, if you try going, breathe in, fill up, and then you try releasing this first on the way back, on the way down. So it's fill up to here, fill up, fill up. But then instead of releasing that first, you try releasing the upper bit first and then the middle. There's a feeling of this stagnating. It's like this doesn't play such a role anymore. It's worth trying. So I'm not going to do it with you now, as you don't need to, but you can try yourselves. So you try reversing. So the rest of your life spent, breathe to here, 1, 2, 3, breathe out, 3, 2, 1. Yeah. So do that. Yeah. Good.